Good afternoon, everyone. Thank you for joining us for session 3 of the virtual resource fair presented by the Helping Hands with Heart Substance Use Disorder Subcommittee. We've got 4 great speakers here today. Possible that more people will come in as we get going. I know of a couple of people who had some conflicting appointments, but it shouldn't really disturb us too much. I apologize if you hear snoring in here. I've got a very small dog who snores like a trucker. So I'll try to keep myself muted as much as possible. I'm Derek Herter, and Georgia Underwood and I kind of have been spearheading this endeavor. We've had 2 sessions so far that have gone really well, and we're really looking forward to hearing some more about the resources available, substance use resources available in and around the Piscataquis County region. With that said, what's going to happen is each presenter, we've got 4 of them, will have 15 minutes allotted to them to kind of explain the services they provide. And then at the end of each session, there will be 5 minutes for general Q&A. If we don't use all the time that's allotted, that's fine. We really just want to get the information out as best we can. Also, any of the presenters who have any materials you'd like us to help distribute to this audience or anywhere, please just email me or Georgia, and we can arrange that. We're really good about getting that information out, and I think it's important to do so. I know outreach is probably 50% of all of our jobs, so we'd love to help you with that as much as we can. So I think we're going to start. The order I have it in is we have Denise Smith talking on NARCAN education at Bangor Public Health. Is that right? All right. So without further ado, Denise, if you want to introduce yourself and tell us a little bit about those services.
Hi, yeah, so I'm Denise Smith. I work at Bangor Public Health and Community Services, and I think I know most everyone here on the call, so familiar faces. And I think probably most everyone knows what NARCAN is. I feel like I have 3 different jobs that make up the work that I do here at Bangor Public Health. The first one is Bangor Public Health is one of 3 organizations that helps to distribute state-supplied NARCAN to state-supplied free NARCAN access to individuals who are at risk of overdose or affected others who, might be around people who are at risk of overdose, to different parts of the state. So we service Penobscot, Piscataquis, Washington, Hancock, and Aroostook counties. And yeah, so I got a little, I also provide training and education around stigma and use and language and prevention as well. So we try to do as much of that as we can just to try to help people understand substance use disorder, because the more we talk about it, the more we normalize it, the better help we can provide, which ultimately, the third piece of that is to help save lives. I feel like all of those things that we do, whether it's directly or indirectly, will help save lives in the end. So that's the goal. One of the goals that we have is helping to provide access to that. The only other thing, really, that I feel like people understand people on this call understand what NARCAN is. We can provide access to that. I feel like Hilary is going to be talking a little bit about what MAP does. I think they have really great access to NARCAN and naloxone. I feel like if people are interested in access to services for NARCAN, I think Piscataquis County is a little bit of a zone where we don't have a lot of providers there. Mayo Hospital has services there, and they provide for their patients. So if there's a provider that you're aware of and that you know that they might want to have Narcan, free Narcan to distribute through Bangor Public Health, and they want to get in touch with us, then I think they can reach out. Hilary is also another really great access point for that, and really that's it for me.
You mentioned stigma reduction as a major component, and it's something that I'm really interested in, to the point where it was kind of a passion of mine is stigma reduction. What successes have you seen during your time at BPH, and like where is our community now as far as that goes?
That's a good question. I feel like we're talking more and more about it. As far as me personally, I feel like we're doing more education around having conversations and targeting different groups to talk about substance use disorder. We are gaining good reach as far as like social media to have those discussions, to put out that information, to talk about language use. I mean, that's huge. Just language and helping people to understand the difference in language and how that can be effective in changing the way people view substance use disorder. We've done some larger presentations. We did a presentation for Penquist Transportation, which I feel like that was early. I feel like I could do a much better job now that I really kind of know more about what I'm doing. That was early on when I first started, but that was a really good reach, I feel like, because they're working with the populations that are traveling to the MAT clinics. And that's such an opportunity for a connection when you're in the car with someone and helping to people understand what an opportunity how important they are. Like those people in the cars, like they're so important to get them to those appointments. And what that really means to someone who's going to that appointment, right? And then just also understanding, why they're going to MAT. Like, it's not just because, they are substituting one drug for another or whatever all these, myths are out there, so that can help people understand what it is. They also have Narcan now. Which I think is a really huge thing. And I was also just talking to Downey's Transportation about some of that same education. So I think that's a really great place to start. We did some education with it's the PrEP Education Committee. Now, I can't remember what the PREP stands for, but it's like all the schools in that area. So it's middle school and high school and all those, someone might know the acronym for that. But I also feel like that was a really great opportunity because you're talking to teachers who then have connections to their students, who have connections to their parents, who, when you're talking about language and the way that we refer to this in the classroom is a great way to make connections. So to answer your question, I don't know exactly, what kind of gains we have. I know that we see and are making gains. We're attempting to make gains because we're having the conversations. And the more that we do that, the more it's going to stick, right?
Derek, could I jump in and ask a question?
Yeah, absolutely.
Yes, thank you all. I think we're mostly either providers of some kind of working in the field in some way or another, trying to help people with substance use disorders. I'm in recovery from alcohol issues. So I apologize, Denise, but you cover which counties again?
Penobscot, Piscataquis, Hancock, Washington, and Aroostook.
Oh, great. And I think I mentioned in a meeting with you some time ago that one of my goals is to make sure that everyone who leaves a jail is offered Narcan. Now, not everyone may take it. And I know you said, Denise, that some progress had been made to connect with the MAT program at Penobscot County Jail to offer those individuals Narcan. And I think you're aware, and I'll just share it again, that on a typical day, there might be 190 or 200 people in Penobscot County Jail. I was one of those individuals for 4.5 months in 2017 into 2018. There are right now, maybe the number has changed in the last few days, 12 people in the MAT program in Penobscot County Jail. So that leaves 170, 180 people, coming in and out of that jail. And so I think I said I would reach out to you. I really want to get this done. There are obviously there are 4 jails in the counties you cover. So I don't know how to move it forward, but let's move it forward somehow. That's one thing I wanted to mention. Also, I never thought about this, but can I help you partner with the, and maybe you already are, with the Penobscot County Adult Drug Treatment Court, the Hancock County Courts, the Washington County Treatment Courts. All of those individuals should have access to NARCAN. And, I was in the program for 15 months, and I don't think we ever discussed whether people in the program had NARCAN. So that's another issue. Number 2, what was the third one? Jails, treatment courts. I'll stop there.
So the MAT clinics, it's a small number. So we do have Narcan and supply the Narcan for the Penobscot and Aroostook County MAT clinics. Hancock County also has it. That's supplied by Healthy Acadia. And Healthy Acadia also supplies Narcan for the people leaving the jail in Washington County.
Yep, they're doing a good job. Absolutely. Terrific.
Yeah, and they also do Hancock County. Penobscot County, and we have Piscataquis County too. They have our Narcan there as well. And so, yeah, I agree. I mean, it's a huge population that should have Narcan when they leave the jails. And I think we're continuing to work to make progress. Specifically in Penobscot County, we really want to have everyone leave with Narcan. There's the options program, and we have another overdose response program team here in Bangor specifically that is continuing to make connections with law enforcement that I think as it moves, it's slow moving. And
yeah, but it doesn't, I appreciate that, but it doesn't have to be. And I won't monopolize the time. And I am speaking up because we're mostly providers and care about these issues so much, but it doesn't have to be. Do we need to, I can talk with Peter Baldacci and Laura Sanborn, 2 of the county commissioners, tomorrow or today if you want, and say, hey, let's get this done. It's not a complicated thing. So I'll email you and maybe we can figure out a way. It doesn't have to be slow. People die fast and many, as you know. So now,
I agree.
Now is the time. What about treatment courts? Should we try to connect those dots?
I've reached out to them. Go ahead, Hilary.
Say we provide naloxone to the treatment courts in Washington County.
Oh, great. Great.
Yeah.
So we've got the courts in Penobscot, Judge Budd, and down in Hancock County. So Denise, maybe we can work together on that. Richard Gordon is the contact, and I can be in touch with him today. Let's get it done.
Anyone else have any other questions or points of discussion on this? I love this conversation. It's fantastic.
You know that Mayo has gotten some supply of naloxone for public distribution from the Bangor Public Health. That came in just before we began worrying about COVID vaccinations, and it's in our pharmacy. Our pharmacist has been trying to put together a program to get it distributed, but she got tasked with a very heavy lift on the COVID vaccinations and the mass vaccination clinics, so that had to sort of get set aside for that. I don't know, Denise Scuderi, I don't know if you've got an update on where Lindsay might be with that or what we can do to get that more out into the community here in Piscataquis County.
I don't have an update from Lindsay. I have reached out to people in this group to get sample policies and so forth and looking on the system one to see how we can roll that out. And then we also have the other distribution
On Sundays.
on Sundays at the Commons that we've been trying to put the word out for too.
That's great.
Any other questions before we move on? Seeing none. Thank you so much, Denise, for your time. You know, if anyone comes up with any questions, we can absolutely get in touch with Denise to get those answered. All right. I'm going to move on now. I'm going to go a little out of order because it just seems to make sense, I think, to bring in Hilary to talk about Maine access points now, because the conversation seems to lead right into it. So Hilary, if you'd like to go next and introduce yourself and tell us a little bit about Maine access points.
Sure. My name is Hilary Eslinger, and I am here with Maine Access Points. It's really lovely to be included in this conversation, and I'm definitely lucky to have worked with some of you before in different work. So just a little bit about Maine Access Points. We are a statewide harm reduction organization. We provide overdose education and naloxone distribution. We also have 3 syringe access programs in Aroostook County, Washington County, and York County. During COVID and through the executive order, we were permitted to do a mail delivery service for harm reduction supplies. And a lot of our work right now, you know, is starting to kind of like move back into in-person trainings, which is really exciting. But what we learned from the pandemic is also that it's really nice to be able to provide virtual services. So we have virtual harm reduction drop-in hours. We have virtual trainings every week for naloxone, and we provide mail delivery of the medication. We're also really just happy to set up one-on-one trainings with people and organizations. And we have a network of peer community distributors across the state. And so, you know, naloxone distribution happens through us, kind of like through that network, through organizations that are distributors with us, and then through our syringe access programs. We're really lucky to be able to work with the Commons actually and supply them with naloxone. They act as distributors for us, and it's been really exciting, and we're building up that relationship. So I'm happy to be connected here to other folks that are connected to them. What else? Something that, you know, is important to us that we provide is aftercare and support. So all of us who work at MAP, you know, have either experienced our own overdoses or have responded to overdoses. And certainly all of us have dealt with a lot of grief and loss. And so we provide peer support to folks who have experienced their own overdose and the folks that are connected to them. And that can look like kind of like informal peer support, one-on-one. It can also look like debriefs for organizations. We're always happy to show up to an organization or a community to kind of help move through, you know, if you've responded to an overdose or if there's some grief and loss that you're experiencing. What else? You know, we do a lot of kind of like trainings with individuals who are using drugs and folks that are close to them, but we certainly also provide access to and education to organizations. We're training folks at Casco Bay Lines right now, so the ferry service in Casco Bay, providing them, you know, kind of going to each of their shifts. We do all the fishing safety trainings in Maine. We provide naloxone and education too. So we have some pretty awesome literature and training specifically for responding on a boat. And that's just because one of our founders is from is a lobster person. And so we've been able to kind of build up education surrounding that. And we recently did the safety trainings for loggers in the state of Maine. So we are happy to get creative. If we are not the expert, I certainly don't know what emergency responses look like for loggers on logging roads, but we partner with people that do, and we can provide the harm reduction education. So it's never kind of like too weird to ask us. We do a lot of restaurants, a lot of different industries. So that's about us. Does anyone have questions? Yeah, I see Madeline.
Thank you so much for presenting. I definitely am looking forward to taking a training myself, but I was wondering if any of your services, like any at all, are available to people under the age of 18, or if everything is 18 and over, or what that kind of looks like.
Yeah, so we do youth trainings and youth education. And so you can certainly, you know, one of our distributors, for example, is New Beginnings. They're mostly based out of Piscataquis County, but they are a outreach team and shelter, and also have supportive housing for young folks, and just work with other youth-led organizing entities. So happy to get the education that folks need. We really hold on to our nasal for young people. We also distribute intramuscular naloxone a lot in community. So we have that choice for folks, but definitely happy to connect with young people, both about harm reduction education, but also for accessing naloxone.
And that's not so much a question as an observation. I think it's both fantastic and fascinating that you've gotten those requests for training for like loggers and folks on boats. And the reason for that is it reminds me, I was in the Navy for 6 years, and I didn't realize this until I went through basic training, that every sailor is also a firefighter. So we're all trained as firefighters. That's a really smart, I think a really smart and creative way of doing this, because when you're out isolated on a logging road or you know, that you can't get off of a boat in the middle of the water, having that training, I think, is so important. I think, you know, going forward, I'm going to try to brainstorm other industries that you need to break into with that.
Yeah, and you know, there's some really beautiful community in the fishing industry and the islands community that, you know, when you're, something that I've learned is when you are out at sea and you are the closest vessel, it's your responsibility to show up to an emergency. And so one way that we have really moved through stigma and kind of like shame that exists within the community is just kind of focusing on that. Like in any industry, in any of our lives, we are people that have, do, or are connected to people that use drugs. But we also know that there's a lot of stigma that exists, and with that, a lot of shame within the industry. And so kind of like working with people to say, you know, it doesn't have to necessarily be for your boat, because people are scared sometimes to say like, I need this for my crew. It's, you need it so that you can take care of others. And we see that with families. You know, there's a lot of really beautiful care that exists. And that's really kind of where we focus a lot of our work, is where those like networks of care that already exist, that have always existed, you know, whether it's folks that use drugs, people in recovery, whatever, you know, who are the caretakers and how do we connect with them and provide them with access? And that's how we get most of our naloxone out. And we're one of the state, like Denise was talking about, we're one of the tier 1 distributors for the state. So we have access to that naloxone that we can support other people in getting. And we kind of, you know, we're a little bit weird. We don't really have a catchment area like the other tier 1s. We're just kind of all over the place. So when in doubt, definitely just ask, and we can usually either connect you to the right tier 1 or just get you what you need.
One question is, might be, you know, I might be just soliciting advice here. So my program, and you know, anyone who's seen my email tag, my program is working with youth affected by the opioid crisis. So generally, children of addicted parents. basically. And, you know, one of the things that I'm really passionately against, and what happens a lot in families like that, is parentification of children, where they end up having to take care of their parents, which is upsetting, but unfortunately sometimes necessary. So what would you say would be, is there training? And this is kind of playing off of Madeline's question. Would you say there's a lower limit to when a kid can be at least told how to administer something?
No, you know, it's really interesting. And I think that, you know, kids are oftentimes the folks that are home. And so in the way that we teach little ones to call 911, we definitely want to prepare and care in that preparation for children and adolescents to be able to get the help that they need. There are definitely teachers of ours that train children to be able to respond in these moments, in the same way that we would train them that if, you know, if your grandma is having a heart attack, what do you do? If your grandma has taken too many of her meds on accident, what do you do? You know, there are a lot of different reasons and situations where a child or a minor would be in the situation to have to call, including friends. And like, you know, I think that there's a really non-stigmatizing and supportive way that we can help support children and their parents to have the education that they need. And certainly, like, we do that, you know, within our mission, which is like really respecting and valuing the lives of people who use drugs. And so how do we support that family unit to find safety in whatever situation is arising for them? And what support do we provide after if someone has to use NARCAN on their mom, or you know, witnesses an overdose and needs support, or is grieving a parent?
Yeah, I'm definitely going to reach out to you. I'm definitely going to reach out to you in the near future.
Georgia?
Yeah, hi. So, Hilary, I'm positive that you must work with our recovery coaches at Healthy Acadia. Yes or no?
Do I work with your recovery coaches at Healthy Acadia?
Yes.
I don't know. Chastity is our program director in Washington County. And so she really coordinates a lot of the naloxone distribution and support there. So I am not positive, but I can be there for them or find out if we do.
Yeah, I think that we'll need to hook up, because as a recovery coach, one of the things is we have affected others, and we see folks that have had accidental OD. So if I was able to hook them up with someone that had experience themselves or knows more about it than I do, I would really be appreciative of that if we would be able to make a partnership out of that.
For sure. Yeah, you know, I think that support looks really different for different folks. Sometimes, just to like give a little context for it as well, you know, people can call, text, they can do encrypted messaging, so Signal, email, we can meet someone in person. And so I think what's really, helpful sometimes about our program is that we're completely anonymous. We don't hold any identifying information. And so someone can reach out by text and not really even identify who they are if they don't want to. And we can provide that support. We have a 24-hour rule. So any of our programs, any of our phones, if you reach out and leave a message and tell us how to get back in touch with you, we will within 24 hours. And so I think that, please, you know, definitely feel free to give folks our information, and also I can connect you with Chastity for that sort of ongoing partnership.
Yeah, I'd love that. I think that's great.
Thanks.
Does anyone else have any questions for Hilary while we have her here?
Just a quick clarifying one for me. I'm so sorry about this. Syringe access points, are they also available to anyone under 18 if needed, or no, that's 18 and above, right?
Yeah, so the CDC requires that it's 18 and older to access syringe access programs in Maine. Yes, but you should connect them to us for other supports and education, because while they can't access syringes, if they are using, we can provide them with education and naloxone and support.
Sure. Thank you so much.
Thanks. Madeline, can I ask where you work out of?
Yes, I work for OCFS, actually. I'm the youth substance use disorder specialist.
Okay,
So,
thank you.
Yeah.
Anything else for Hilary? All right, thank you so much for your time, Hilary. That was great.
Thanks, Denise, for making the connection.
So next on our list, we've got Dr. Dave McDermott from Mayo Regional Hospital to talk about substance use services available there. So feel free to take it away, Dr. McDermott.
Guess I've got to hit that unmute button in order to get that to work, huh? So, greetings. Thank you for the opportunity to talk here today. The main focus I wanted to talk about today is the ongoing medication-assisted treatment programs that we have and we offer here, both at Mayo and at Charles A. Dean hospitals in Piscataquis County. To my awareness, there's no other clinics in the county that are offering Suboxone therapy for patients in long-term recovery. There was a provider at the Katahdin Valley Health Center in Brownville, but I don't think she's with them anymore, and I don't think they ever offered those services there. Currently, we offer medication-assisted treatment in our clinic in Milo, as well as through a dedicated psychiatry and counseling practice here in Dover-Foxcroft. There's a smaller opportunity in Greenville as well, run primarily through the emergency department there with one of their physicians, Dr. Carl Lieberman. Dr. Lieberman is a family physician like myself who practices emergency medicine. He only works a couple of days a month in Greenville, and the rest of his time he lives down in Massachusetts and has a program dedicated, a practice down there dedicated to helping people who live with substance use disorder be effective and living in recovery. So he does a lot of remote work using telemedicine to manage a pool. I think it's relatively small. I think it's less than 10 patients in the greater Greenville area, Greenville, Shirley, Rockwood, who come to him for MAT. Locally here in southern Piscataquis County, we have about 30 to 40 patients enrolled in MAT at our Milo family practice location, or it's now Northern Light Primary Care Milo, with two practitioners over there that have their X-waivers and are engaged. Dr. Kate McDermott, who's no relationship to me, but a young family physician who joined us last fall. And now Patrick St. Ledger, who is a nurse practitioner who just recently moved to the area from Florida and has his X-waiver, managing those patients there. At Northern Light Behavioral Health here at our campus in Dover-Foxcroft, Marilyn Pettit and myself manage a panel of about 30 to 40 patients on MAT. But what I wanted to talk about here is that we are changing our model for that. We've been working with our partners at Acadia Hospital, and Jacquelyn Sear has been helpful with us on that. I see Jacquelyn's on the call today. We are going to be, over the next several months, closing our practice site for psychiatry and counseling as we work to integrate all of those services into our primary care practices across the region. Primary care is mental health care. Mental health care is primary care. And instead of having people living in silos where you just go to one site for a particular service, we're going to be expanding those services and offerings within our primary care practices. We have primary care practices in Corinth, Dexter, Dover, and Milo, as well as our colleagues at Dean have primary care practices in Sangerville, Monson, and Greenville. For quite some time, our Dean colleagues have integrated behavioral health into their primary care practices through the use of telemedicine in conjunction with clinicians at the Acadia Hospital. They have designated spaces in their offices where patients can go in using telemedicine techniques, using iPads and things. They connect with master's level clinicians and also with psychiatric nurse practitioners who work with them for medication management and counseling. We're going to be doing more of that here at Mayo. Our current master's level clinicians will be moving into our primary care practices. They will do a blend of in-person and video counseling and support for patients, but increase the access in the clinic. So it's nice if I'm a primary care physician in Dover, I can do a warm handoff of a patient who needs acute services to someone who's right down the hall instead of saying, well, now you got to go across town. There's less stigma associated with it as well. You're going into the primary care practice. Nobody knows if you're going in for a pap smear or for a blood pressure check or to talk to somebody about your substance use disorder. We will be working with colleagues at Acadia to provide the clinician, the psychiatric nurse practitioner level care, and continuing to do the ongoing MAT with that. Through this transition, we're going to be taking one of our registered nurses who currently works in our psychiatry facility, John Haley. John has been really a cornerstone for our MAT program there. John is now going to be tasked with building capacity and supporting capacity for MAT across all of our primary care practice sites here. As I mentioned, currently the only primary care site where we're doing MAT is in Milo. We have clinicians who have an interest. We have clinicians in Dover who have their X waivers but are currently not offering MAT services. We have clinicians in Milo who have an interest, and I believe that we can get enough interest in Corinth to be able to offer it there as well. So my goal is by the end of the year to have us offering MAT therapy out of all of our primary care practices. Just like all of our primary care practitioners treat diabetes and give people insulin if they need insulin to control the diabetes, they shouldn't be carving out and saying we're not going to take care of MAT because that's Suboxone. The Biden administration has put in place a process to decrease the barriers to getting access for buprenorphine prescribing. The Trump administration tried to do that, but they ran up against some technical glitches in doing that. But the Biden administration is now basically, you still have to have an X waiver because Congress says you have to have an X waiver, but you no longer need 8 to 24 hours worth of online training to get that. You just have to apply for it and they will send one to you. So we're hoping that this transition will increase the support available in our primary care practices to support MAT and increase the accessibility and remove the silo that was around behavioral health services here in Piscataquis County. We also do provide the primary care for the residents of the Piscataquis County Jail. I know there's talk about Penobscot County Jail earlier in the conversation here. Piscataquis has at most a 40-bed capacity. I think they're currently running around 25 to 30 patients. There are 2 or 3 patients there that we currently have on buprenorphine, and we arrange for that for them when they get discharged. I don't think that we're yet providing naloxone to everybody getting discharged from that facility, but that's a great idea, and I've taken some notes about that from this call here. So I'd be certainly happy to answer any questions people have about availability. Again, our goal is to expand access to medication-assisted treatment here in Piscataquis County, and I think we've got the resources. We just have to get them aligned in the right places and with the right support to be able to do that.
Doctor, I guess I'll jump in. You had mentioned Piscataquis County Jail. The folks you were treating there, providing medication to, were they already receiving the medicine before were they already on MAT before they were incarcerated?
Majority were on MAT before they were incarcerated. We've done 1 or 2 inductions for people who came in who were using prior to their incarceration, and we did an induction while they were there to help them with their withdrawal symptoms and to get them into an early process of recovery.
And so the jail is open to that?
Yes, they are.
Okay. Well, I'm glad to hear that. you know, I was meeting earlier today with two folks at Somerset County Jail, and one individual was saying that he wanted to be on MAT, but they don't start people on MAT while at that particular jail. And that's the case in many jails, as you may know. And that's really unfortunate. So I'm glad that Piscataquis County Jail is open to that.
Yes, it's been about 2 years now since the Piscataquis changed their contract for the provision of medical services from a vendor that I do think continues to supply services to Somerset and to some other jails in the state. They changed from that vendor to us for that. And I think one of their goals was to be able to look at this as an option down the road.
And when you say to, this is my last question. When you say to us, who are you with again?
Okay, I'm sorry. I'm with Mayo Hospital, Northern Light Mayo Hospital in Dover, Foxcroft.
Okay, MedPro is the vendor at several county jails, the healthcare provider, which is obviously separate from you folks.
MedPro had been the vendor here at Piscataquis County Jail.
Right.
And the Piscataquis County Jail is very happy to have a different relationship than what they had before.
Good to know. Thank you very much.
I had a question. So you're combining your primary care and your counseling services. So what does that mean for somebody that may not have a primary care within Northern Light, but maybe their primary care is somewhere else? Can they still get counseling services through Mayo?
They should be able to get counseling services through Mayo. Certainly if they are currently getting counseling services through Mayo, they'd be able to continue. And Jacquelyn, I don't know if you have a sense of how well that works in other sites where Acadia's integrated behavioral health model has worked. I can't imagine that we would prohibit people who aren't our patients from doing that. I'm not going to absolutely promise that they have that access.
Yes, absolutely. We definitely partner with other organizations that are using with medication management through their organization, therapy through us. We just make sure we do collaboration, and definitely would not cut anybody off from their providers they've already established. That relationship is so important, as you all know.
Thank you. And also, I just have one more question. Does Mayo Hospital work with any of the detox centers to send? So if I came in and I need a detox, what would you do with me? Where would you send me?
Well, until 2 weeks ago, I would have said we didn't have access, but a neighbor of mine here in town, the gentleman who lives across the street, recently joined the board at Wellspring, and had a conversation with him at a public event locally about Wellspring and their services. When Wellspring first opened their detox facility in the greater Bangor area, the only access to it was through the emergency departments at St. Joe's and at Eastern Maine. I was completely unaware that they had expanded that. So within the last month, just a couple of weeks ago, the leaders from Wellspring came up virtually, met with our hospitalist team and our emergency medicine team to explain what they have for resources and how we can access that, and that they are open to referrals from our emergency department and from our inpatient care team for that. So a month ago, I would have said you're out of luck if you need access to acute detox and you just need detox. But now I would tell you that Wellspring is our go-to option for that.
Fantastic. Thank you so much. That just made me so happy.
It made us happy because it's not an uncommon complaint that we have people coming in saying, what can I do? How do I get help? I get calls from family members who are living with people who live with a variety of different substance use disorders and saying, what are my options? How can I access that?
Hi, Georgia.
Hi. Oh, I think this is all wonderful news. I'm just wondering about rehabs. Do we have any, so currently right now, when I need to get somebody into a rehab, it's really hard. Really hard. I don't know if anybody here has heard of any expansion on how to do that. Sometimes you have a person that isn't in a detox situation, but really needs to go to rehab or is ready to go to rehab, and you want to get them there as quickly as possible. Does anyone have any advice for me?
Hey everyone, I'm Jackie. So just to jump on that, Georgia, thank you for sharing that, Dr. McDermott, as well, for the Wellsprings piece. You know, there's a difference between detox and rehab. And both can be difficult to get into depending on bed availability because the need is so huge in our state right now, right? Currently for rehab placements, so once they're through that acute phase and need that more long-term, having success with working with not only Wellsprings, but Crossroads out of the Waterville area. Liberty Bay has really stepped up in the Portland area and has been helping a lot of individuals. Penn Bay does have a couple of beds, but not for that long term. That's more that acute detox period. And there are a couple others that I'm not thinking of at the moment, but I can send out some notes to Derek and that can get sent out to the group. And I do know that we're, New Horizons, sorry, that was the one I was trying to think of, through PCHC as well. And, you know, advocate, that's all we can do, right? And it never hurts when the patient themselves reaches out and then we follow it up with a call. It gives it a little bit more oomph to get it moved along.
One of the things I learned from talking with the folks at Wellspring is that they don't have to come to an emergency department in order to go there. They can call directly and, you know, get a bed confirmation and assignment and come in to be evaluated for their detox program. So that was news to me that I wasn't aware of.
And that's a new change, which is fantastic. COVID kind of threw a little monkey wrench in there, so to speak, for a little bit because there was testing required before they could go. But yeah, that's great.
You know, the number that they gave us was 217-6521.
Yeah, I'll just add that it's a terrific place. I do an AA meeting there on Sunday nights, which we've just started up again. It's terrific. Getting in used to be really easy in terms of capacity. Unfortunately, it was never filled. But Milestone, if I have that right, in Portland temporarily closed its detox, and I don't know the status of that. So New Horizons has been at capacity at times, but it's a terrific place. Highly recommend it. I was going to say that two things. One, that some of you probably know, it's not treatment, obviously, but the recovery residence community in the greater Bangor area has been expanding. It has quadrupled in size in the last 3 years. There are several Fresh Start sober living houses. I'm sure some of you or most of you are aware. If you're not aware, let me know and I'll give you information about Fresh Start sober living houses in Bangor and Brewer. So that is in treatment, but it's a place for many people to get some help and support. The other thing I was going to say is, all counties in Maine and nationally have just been given a pot of money through the American Rescue Plan. The federal government gave municipalities and counties and states a lot of money. And so in my advocacy work, wearing that hat, I'm trying to encourage Penobscot County commissioners to invest in solutions that will keep fewer people from going to jail. Things like expanded mental health care, expanded substance use disorder treatment, housing, affordable housing. Penobscot County, as an example, is receiving $30 million in this 1 year period, getting half of it now, half of it in a year. I don't know what Piscataquis County is getting. It will be much less, but there are dollars there if people want to advocate for investments in solutions. Thanks.
I just had a quick question for Dr. McDermott. Do you, in your opinion, this can be like kind of anecdotal or however it feels to you, but I just feel like I haven't heard a ton about new MAT providers since the Biden administration did change the rule. It was only about a month ago for the X waiver. I feel like maybe 2 months at this point. But do you think that that change is kind of like disseminating into the provider landscape here in Maine well, or do you think folks don't know about it and are maybe still not getting their X waiver? Really, I'm thinking about the inability for youth to get MAT throughout the state and youth to get providers to be comfortable making that referral. So I'm thinking about ways to try and encourage more providers to get on that train, and would love to know if you think that that change has trickled down yet.
I think the awareness of the elimination of the requirement for the training to get the X waiver has trickled down and been promulgated throughout the provider community here. I would say that many of the people, the early adopters, have already gone on and gotten the training and gotten their X waiver and are working on it. I think it's up to us as systems to try to create the capacity and the support for people so that they realize that they can do this. And it's not something that's esoteric and difficult to do, so that they're comfortable applying for their X waiver and getting that. So that is a bigger lift, requires more resources. Again, for us locally, our hope is that our transition and the way we structure our MAT program will encourage that to happen. Just because all of a sudden someone whose practice is full and they're swamped with other tasks has the ability to expand their practice doesn't necessarily mean that they're going to do that without some degree of encouragement and assurance that there's going to be people there to help them with that. Good question. The need is still there. The barriers are lower, but they are still barriers, and none of our primary care practitioners are sitting in their office looking for patients to come in saying, gee, how can I increase the volume of business I'm doing? They're saying no every day to their own established patients that need care that they can't get in. We still struggle to have sufficient numbers of members on our primary care team. We've lost several practitioners who've now transitioned to local practices elsewhere over the last year for a variety of different reasons and have not yet replaced all of them. Yet the net population of Piscataquis County hasn't declined. So none of them are saying, ooh, I need to do something new so that I can fill this void in my schedule.
Great information. Any more questions or comments for Dr. McDermott? All right. Thank you so much for your time. And again, if anyone has any questions that come up as we go on, just feel free to send them my way and we'll get them to you, or contact Dr. McDermott. So our last presenter is Jacquelyn Sear, who is director of, I forgot your title, director of substance use services at Acadia Hospital. And Jack, if you want to take it away and introduce yourself, probably better than I did.
Title. Hi, everyone. I'm Jackie Sear, and I'm wicked giddy over here, so I'm going to try to contain myself. I'm extremely passionate about what we do, and all of you have kind of dropped some little nuggets, and I've got all kinds of notes going here on the things we can do moving forward. But I think it's really important. Obviously, we're here talking about, opioid use disorder and need for services and all of that, but we have to remember that addiction is addiction is addiction. And anything that can bring pleasure to the human mind and body, once it crosses that line, can become an addiction if negative consequences are being gathered with that. So I think it's really, really important as we're talking about services that we're also being mindful of some other substances of misuse or abuse that could be taking place in the patients or people that we're encountering, including our coworkers, our family members. The more information we get out there, it may not be the person that's sitting directly in front of you that we may be helping in that moment. It may be someone else that they know. So that NARCAN getting out there and all of those different things, it's huge. So I'm going to contain myself and talk about programming and then try to catch up on some of these other points here. But here at Acadia, we have 3 different levels of MAT programming. We have our methadone treatment program. We have a daily dosing Suboxone program. And then we have a prescription program that happens out of our Bangor Adults Clinic. We are staffed by nurse practitioner, a doctor. We have RNs, LADCs, CADCs, Masters Prepared Social Work. And we're very fortunate to be able to partner with our intensive outpatient programming just down the way to get people connected. And I think that that's really important to, when we're looking at wrapping care around the individuals that we're working with, that addiction more often than not does not stand alone. And there's a lot of co-occurring things happening, and that we're being mindful of that as well. Love the fact that none of us can nor do this alone. We have to partner with everybody that's out there. The more we are on a screen together doing this, that's really awesome. So our IOP program is open to anybody who is needing additional services. There is a requirement for that, however, that the individual will be able to attend 9 groups per week, and it would go anywhere from 10 to 12 weeks, typically, sometimes less, depending on what the patient's needs are. There are substance use disorder groups that are in there, but there's also spirituality, anxiety, depression, coping skills, aftercare stuff, those different topics that are captured. And then we have therapy services as well. One of the things that I'm most excited about, Dr. McDermott touched upon, is I believe, as many of you, that everybody deserves good care. And it doesn't matter what your diagnosis is, right? It doesn't matter if it's asthma, diabetes, opioid use disorder, stimulant use disorder, alcoholism, it doesn't matter. Our patients didn't sign up for Jackie Sear to be sitting in this chair. I signed up to be in this chair. So I need to be bringing my A game and being okay with asking the questions. Doesn't matter if you're the chief of a hospital or you are unemployed and struggling with finding a home, right? Anybody and everybody has the potential or could be in a situation where addiction is an issue for them. We're heading in that direction. So really working with providers and frontline office staff, anybody who is going to come in contact with anybody, to be equipped with the ability to ask the right questions. Don't have to have all the right answers, but be willing to have those conversations with getting people connected in a judgment-free zone. So as we move, sorry, I'm getting excited. As we are moving into the primary care model, this is huge, right? Because we look at oftentimes as people as different compartments, right? But none of us are just from the neck up or the neck down. We're whole beings, and it all needs to be addressed. Now, that doesn't mean that if somebody needs a higher level of care that you wouldn't refer off, right? If I'm a podiatrist, I'm not going to sign up to deliver somebody's baby, right? But I can say, hey, we've got this going on, and I can help manage up until this point, but things are a little more complicated, so now I'm going to connect you with the next service line. And to answer the question about how the reducing of the waiver, taking that away, where some of the primary care staff are at is, if they weren't feeling comfortable before, taking that away doesn't solve anything. It's about making sure that supports are in place. And if the majority of the providers that I speak with, it's not that they don't want to do the care or that they don't believe in it. It's that fear of being alone. Right? Like, what do I do if I get this person in and I start them on MAT? Suboxone is available, but what if Suboxone is not cutting it and they need methadone, right? What do they do? Where do they go? Who do they call? A number of our clinics are at capacity, but not all of us are at capacity. So it's, if you get a no here, did you check here? Utilizing our recovery communities, peer supports, recovery coaches, knowing what you have out there for resources is huge. And just, again, knowing that you're not alone in it. Dr. McDermott's great as far as he'll shoot a message off, getting me connected with somebody. I might reach out to him about something that's happening in his area. Just opening the door for a conversation. I don't remember what time we end, so I'm trying to talk quick, but I wanted to also talk about alcoholism, just a smidge, because we know that alcoholism, alcohol misuse and abuse has been an issue for years and years and years, right? More people die of tobacco use and alcoholism than any other substances of abuse other than food. So, but we don't look at it the same way. And we don't always have the right services are available or enough services available. And we don't always ask the questions the right way when you're trying to figure out if someone's having a hard time or not. And we talk a lot about, boy, really rough day at work. I think I'm gonna have a glass of wine or two, where people make jokes about that and whatnot, and it's more visible. So really wanna put the plug in that we start asking more questions about that. Lots of great community services out there available. As we're standing up our new behavioral health model for Northern Light Health, we are partnering with Hazelton Betty Ford and are looking to start rolling out some additional services in that regard, as well as having outpatient groups available in our IOP program. So that's in development. I'm looking at Doug, but you can't tell that. I was writing notes on your questions. Recently have had conversation with the Maine State Prison collective, if you will, very early stages, but hoping to be able to help support. Sounds like a great group of people, very energized, the two individuals that I spoke with, and being able to get treatment initiated once they're there, not just having to come in on it. So we really are shifting in breaking down the stigmas, but it's going to take time, and it's going to take more people being willing to have the conversation and be comfortable having the conversation, and also being okay with, I don't know the answer to that, but I know Derek, so I'm going to call Derek and I'm going to ask him a couple questions, and I'm going to get somebody to reach back out to you, or having people come to staff meetings to talk about what's going on out there. Derek came and did a wonderful job talking to our staff. And I was making notes as Dr. McDermott was talking about Wellsprings coming, and anybody that's on the call that would be interested in coming to one of our meetings and talking about the services that you're providing out there, because I don't think we can saturate the providers in our community with enough knowledge about what's available out there. You know, the more we talk about it, the more comfortable we come with it, right? With having those conversations. Who knows, maybe someday there'll be no stigma at all, right? So I think I covered all of our services. Questions?
I think you're right, and that's, you know, that's what I'm hoping that these sessions, these information sessions, will kind of play into that we can't have too much information. I learn new stuff daily just talking to other providers, because Georgia and I were having a conversation about it earlier before this call, about just, we don't know what we don't know until we talk to someone, you know. So, you know, and I really appreciate that. I definitely appreciated the time to be able to talk to your staff, and I would really highly recommend anyone who wants to get there, do a little bit of outreach, contact Jackie.
That'd be great. Thank you. I also, just to tag on to Denise's talk about the NARCAN and everybody else that did, if you are working with someone that you know is utilizing a different substance, please also get NARCAN to them. A large number of our folks who are overdosing that are utilizing methamphetamine, cocaine, even within the benzos, because they're trying to buy bars and there's so many things being cut into it, they're overdosing because they're opioid naive and there's fentanyl in a lot of the things and they're using it unknowingly. So if you have someone who you know is using illicit substances, please get NARCAN in their hands.
Great. Does anyone have any questions? Well, we have Jacquelyn on the line.
Jacquelyn, I don't know if you knew, you mentioned the Department of Corrections. I don't know if you're aware, and maybe this is news for some, that DOC is starting it's their first, as far as I know, transitional housing unit in Bangor. So people releasing from DOC who are sort of in an emergency situation, or there are other ways that they can utilize this housing, but it's the first transitional housing program in Maine. It'll be above the probation office out on the Dorothea Dix campus out there. It's good, and there's a group that's working to try to provide services or be available to the people. I think it's going to open in about a month. Unlike most states, as many of you may know, Maine does little or nothing, and has done little or nothing for people releasing from our prisons. You get $50 and a bus ticket if you can work with the right people. That's what we've done in Maine for many years, but now there'll be this first house, hopefully the first of a number of them. And so maybe I can connect you with that so you will know more. If anyone else wants to know more about it, my email's in the chat. You can let me know. Thanks.
Thank you for that. I also just wanted to state that we talk a lot about MAT, and medicine to treat disease processes is great, right? But medicine's not the answer for everybody. And so I think that we have to make sure that we're treating the right thing with the right treatment modality, and recognizing where someone is in their use, what else is possibly going on. Sometimes someone will come in, and once you're doing the evaluation and you're having the conversation, it's, okay, what do you think about going to an IOP program for a little bit to see what's going on here? Because there's a lot of different things that look like withdrawal. There's a lot of different things that look like a substance use disorder, and people get tagged with labels, but it could be something else going on. So MAT is fantastic, and I'm so glad that it's out there. We just want to make sure we're treating the right thing. So drilling down and knowing what the underlying cause is, that can happen along the way as you're doing MAT. Again, it's very individualized and recognizing where the individual is. So just know that you're going to encounter people on that entire spectrum, right? And what is the difference between use and addiction, or misuse and addiction?
Yeah, I think it kind of speaks more to again, to that kind of holistic modality that you were espousing earlier, that there are multiple pathways to recovery. And I think just about everything should be coupled with some level of counseling, so we can get at the, where's the trauma, what's happening, what happened to you, not,
And I think that the counseling piece is huge in early recovery for a lot of folks. It's very murky water, if not muddy, as to where the counseling piece comes in. Now, with the change in the Biden administration's reduction of barriers, they have reduced or are not requiring counseling as being a component of that, but it very much can be a part of your treatment with your patients. But making sure that we're recognizing people as individuals, and someone may need counseling in the beginning on a weekly basis, right? Someone may need to continue to do counseling monthly for an extended period of time, but someone else might be very stable in their recovery, have increased functionality, quality of life, everything seems to be going well. They don't need to be seen as often. So I think of it as, when I'm talking to providers about, you know, if I have a type 2 diabetic who's been doing really well for a while, been stable on their medications, their numbers are looking good, I'm still going to occasionally touch base on those lifestyle pieces of their disease process to make sure things are going okay. Do they have any questions? Are they noticing that they're sliding back in any one area? Because, you know, complacency happens for everybody, not just people in recovery. It happens with those of us, you know, it happens in our jobs, right? You get so used to doing the same routines, exercise, nutrition, relationships. You know, people just tend to lose sight of some areas that might need to have a little fine tuning. So the counseling piece is huge, and it doesn't necessarily mean that you need to sit with a therapist. Maybe it's just popping in on a group. And maybe it's an in-person group, or maybe you're hopping online and accessing, you know, AA or NA for a virtual. They have 24-hour groups all across the nation, so it truly can be anonymous. But just checking in, doing that self-check.
Excellent. Any other questions or comments for Jackie before we wrap up? All right. Well, really want to thank everyone, thank our presenters for sharing that information today. I think this was a fantastic session. Thank you for the great questions and conversation that we've had from our attendees. I love hearing these conversations happen. And that's, you know, that's really what this is for, is to, you know, create those community conversations. I know a lot of times we end up a lot of providers or people in the industry all in the same room, and it seems like preaching to the choir a lot of times. So that's why I'm really glad that these conversations happen, and I do feel like you know, I learned a lot today. That said, unless there's any other questions or comments, thank you very much for being here. Everyone stay cool. It's really hot out there. Try to stay in the AC if you can. Drink lots of water.
Thank you. Thank you. Bye, everybody.
Bye. Thank you.
Bye.
Bye.